All right, let's look at the anatomy of the AP lumbar spine and talk about how that anatomy ties in with critiquing our images to know that we have positioned it properly and that we have a diagnostic image to send. So what we're looking at is the AP lumbar spine here. The patient lies flat on the table with their knees bent, their hips tucked. Central ray with a large collimated field. The central ray would go at the level of the iliac crest, which is at lumbar level, lumbar 4 to 5. So let's take a look at this anatomy. First, I'd like to highlight the intervertebral disc spaces. So I'm just going to highlight those intervertebral disc spaces between each vertebra. All right, now let's find those little pedicles. I'm always talking about these pedicles. We look at these pedicles to be what we call symmetrical or equidistant from the either the midline of the vertebra or equidistant from the lateral borders of the vertebral bodies. All right, now let's look for spinous processes. We look for the spinous processes to be centered down the vertebral body. So we would say spinous processes are centered down the vertebral body. So when we talk about something being centered or equidistant, we're talking about the fact that the patient's body was straight on the table with no rotation. They're in a true anatomical position, lying flat on the table. So let's look at transverse processes. Transverse processes project laterally, darker, laterally from the vertebral body. So this is another structure. These are two structures that we look for to project laterally from the vertebral body. And that's going to tell us, once again, if they're equidistant, if they're symmetrical, that means that the patient was not rotated, that we had the patient positioned properly for the x-ray. So it's a transverse processes. Another thing that we can look for is the SI joint, the sacroiliac joint. This is the sacroiliac joint here, where the sacrum and the ilium articulate. I'm just gonna continue this out to show you the outline of the sacrum here. It's the base of the sacrum there, where L5 sits on the base of the sacrum. All right, and then I'm gonna use maybe a little bit more purple and show you the ilium. Oops, should be a little more rounded there. All right, and there's the ilium. All right. Also, we will look for the SI joints to be symmetrical. We can look for the ilium, what part of it we can see there to be symmetrical. Note that would demonstrate no rotation. Down here we have the femoral heads. We can look for those to be symmetrical. So all of those things that I just mentioned, transverse processes, pedicles, SI joints, the femoral heads, the ilium, even the ala of the sacrum, which would be this area in here, that's actually called the ala of the sacrum. We can even talk about that. The two ala, the right and left ala, to be symmetrical. And all of that is telling us that the patient was not rotated when we took the x-ray. Now, the intervertebral disc spaces are important because that tells us that the patient's spine was placed parallel to the table. If you're looking at your image and you cannot identify those intervertebral disc spaces that I've highlighted here, if those areas are superimposed with, say, the end plates of the vertebral bodies, then we know that the patient's spine was curved up away from the table when we took the x-ray, and that the spine was not placed parallel to the table. So I think that was all of the anatomy I wanted to go over. So once again, AP lumbar spine, patient is flat on the table, knees slightly bent, the hips are tucked to place the spine parallel to the table. This is demonstrated by open intervertebral disc spaces. Patient is flat on the table, straight with no rotation, demonstrated by symmetry of the transverse processes, symmetry of the pedicles, spinous processes centered down the center of the vertebral body. Symmetry of the right and left SI joints, symmetry of the right and left ala of the sacrum and the right and left ala of the ilium. Also symmetry of the right and left femoral heads. So this is a way that you can look at your image to know that you have properly positioned your patient for the image. Thanks for watching. All right, so let's look at the anatomy of an oblique lumbar vertebra X-ray. This image is done in different obliquities depending on the part of the spine that is of interest, but routinely it is done at a 45-degree oblique rotation of the patient's body. By looking at the ilium, I can identify what position this patient was in. There's also another trick I'm going to talk about that a lot of radiologic technologists use, which is called the Scottie dog symbol, which is created by the distortion of the structures of the vertebral body and the structures projecting off of the vertebral body. All of those structures make what's called a Scottie dog type of shadow on the image itself. So I'm going to identify that, and we're going to look through the anatomy and talk about positioning of the patient. So we're going to just assume and look at this image as if it was done as an AP projection, meaning that the beam entered the front of the body and exited the back of the body. This means that the patient was placed on their back, or their back they were standing up at the upright bucky with their back against the bucky, their back against the table, closer to the IR, so that the beam is entering their anterior side. So that would mean that the position could only be a posterior oblique. If the X-ray is entering the front of the body and exiting the back, that means they're in a posterior oblique position. So if I tell you this is an AP projection, you need to know right away, oh, that's a posterior oblique position. All right, so now we can look at the ilium to identify the rotation. In the obliques, you can identify the rotation of the patient by looking at the ilium, what side is elongated, what side is foreshortened. So here we can see that the right ala is elongated, whereas the left side is foreshortened. So that tells me that the patient is lying with their right side down on the table, and their right ilium is being elongated. All right, so now this also tells me that we're going to be looking at the right side. We're going to be looking at structures on the right side of the lumbar vertebra for this image specifically. So now this little Scottie dog that I was talking about he lives right here in the center of the vertebra. I'm just going to try to outline him a little bit here. See a little bit of a leg here, and then his back, and then a back leg here, right? So that's what we call the little Scottie dog. This area here is the pedicle. That little round opaque circle is the pedicle, the right pedicle on each vertebral body here. The right pedicle that I'm shading in right now. All right, that's the right pedicle. That's the eye of our Scottie dog. So then let me see, I'm gonna go ahead and draw in his ear. That would be his ear. This would be his nose. Inferiorly will be his leg, his front leg. And then we're going back around here. And this is his back, right here. So all of the structures that I'm labeling here are all part of the lumbar vertebra. So here we have, I'm going to erase this. So I can go in more detail here and try to outline what we're seeing. Right. This would be kind of his tail sticking out. This is his other leg posteriorly. All right, so what we're looking at are the structures on the right side. So this would be the right transverse process of that vertebra. This would be the right superior articular process of that vertebra. This would be the right inferior articular process of that specific vertebra. And then this is the pedicle of that vertebra, the right pedicle of that vertebra. Now, in between each vertebra, between the superior articular process of one dog and the inferior articular process of the other dog, which is the actual vertebra, here, right, we have what's called the zygapophyseal joint. The zygapophyseal joint sits right between the superior articular processes and the inferior articular processes. All right, so this is the anatomy. Now, if you'll notice that this is the right side of the patient's body, this is the left side of the patient's body. So the dog is looking towards the right. So that's a little trick that the rad techs use to decide, you know, to be able to look at this x-ray and know right away, oh, the dog's looking towards the right. So the patient was looking towards the right. It's an RPO position, right posterior oblique position with an AP projection of the beam. So I hope this was helpful in identifying the position of the patient by looking at the x-ray and identifying the anatomy and what we're looking for in our x-rays here. Also, we can talk about over and under rotation very briefly, because we will follow the pedicles to see if our patient is over or under rotated. So usually our routine positioning would be a 45-degree oblique. But if we look at our image and we see that the pedicle is not, you know, the pedicles we say should be relatively centered in the vertebral body, right? If we say that the pedicle is more anterior, say the pedicle is projected more anteriorly on the body, let me change that color here. We say the pedicle is more anterior, like in this area here, then that would mean that the patient is under rotated. If the pedicle is projected more anteriorly, it means that the patient is under rotated, meaning that we did not rotate them a full 45 degrees. Now, if the pedicle is projected more posteriorly on the body, then that would mean that the patient is over rotated, that they're rotated more laterally, so that they're rotated even more than 45, more than they should be, over rotation. So pedicle projected posteriorly on the body is over rotation. If the pedicle is anterior,